I'm going to talk to you a bit about knowledge translation, and you may be familiar with what that is, or you may not. So I'm just going to give you a very brief description of what it's supposed to be. And that is, it's getting the best knowledge to people at the right time and in the right form. So I'm going to talk a little bit about the history as well. When we're talking about knowledge translation, it began really as knowledge transfer. So that was what we call the push. This began when scientists, researchers, started wanting to get information about their research out to other scientists, but not necessarily to the general population or to patient groups either. It was really that they were publishing papers in journals and they were holding conferences for their fellow scientists. It was their responsibility. This is the way they wanted to get information out there so people could act on it. But essentially that was for those people to find a way of acting on it for themselves. What then began happening was the beginnings of knowledge translation. And this is what we call the pull. Because what started happening is that the different groups of people, patient groups, scientists, policy people, started wanting to get information from scientists that could back up their practices or give them information about conditions. And so this was the beginning. Now, this started because there were a number of actual social changes and technological changes that were going on at that time. So this was around the late 80s, early 90s. So around the late 80s, early 90s, McMaster University started talking about evidence-based practice. That meant that physicians and other practitioners would start using evidence from good quality research that they knew that these conditions, that they knew the treatments were both effective and safe. And most treatments at that time, and still to some extent now, are not based on good evidence. So this was the idea. They started pushing this, and they started responding to the needs of different organizations, different groups of people, for individuals. The other thing that was happening at this time was the World Wide Web. So information started going out on the web, and people were looking at that and wanting to be involved in the process of diagnosis and treatment. They wanted to have a say. They wanted to have skills that are necessary to be able to understand what they were reading that the scientists were publishing. So the other thing that's occurred, and this has been occurring more recently than that, and that is called the exchange. And this is what PON does. We're engaged in two-way, three-way, four-way, five-way conversations. We have a number of people who are involved in establishing research agendas so that scientists know what different groups of people want to have researched. And we are providing means of providing information to people so that they can understand what the scientists are doing as well. Okay, so knowledge transfer was originally around, as I said, diffusion. So that was one means of getting information out. So there were journals that people read. There were newsletters provided to, like, the family groups, and there are websites such as we have as well. There's also what's termed dissemination, which means that there is an expectation that people are going to learn and take away this information, and that is that you have mailing of research results. There are conferences such as this, and workshops as well. Then you get to knowledge translation, where you're talking about implementation. And instead of just passively giving people information, what you're doing is that you're involved with different groups about getting research into practice. And so that involves using audits where, for instance, if you're a family doctor and there's an expectation that you're going to be providing certain tests for your patients, and that there are targets for you, so that 90% of your 2-year-olds are going to have, such and such a vaccination. They go in and they look at the rates and say, well, you're not meeting the 90%, that's an expectation. So you need to be changing something in your practice because we know that this is effective and you should be doing this. Okay. There's also face-to-face contact with experts so that you can actually go and talk to individuals like you're doing here. You can talk to the scientists here. So what POND is involved in doing is what's called knowledge translation and exchange. So it's, as it says, it's the process of sharing useful evidence-based research findings with decision makers. That may be policy people, that may be people who are running hospitals or clinics or what have you, and others who use the research. So again, the other people who are using the research are you folks, because you want to know what's going on as well. But the thing is that you don't necessarily can be expected to have the skills necessary to read journal articles. Those are intended for use by the scientists. And however, more and more journals are requiring that the scientists provide plain language explanations of what they've been doing. Okay. But what KTE does is it brings together a whole group. When Dr. Nyland was talking, he was talking about bringing together the advocacy groups, industry, the scientists, different groups of people together, all different kinds of practitioners together. And that is what knowledge translation and exchange is, because it's not one directional. It's not somebody, the scientist, dictating to you what this is about or what we're going to be doing. It means that there are a number of different groups of people who have a say in what's going on. And so you can come here and say, well, yes, you're researching this and we're very interested in what you're researching, but our everyday lives are different than what you're talking about. We need you to take into consideration what's happening in our homes, what's happening with their kids at school. So that's one way that KTE works. So we do things in POND KTE process. We consult with our patient advisory committee. There are some members here. We hold conferences with the parents and other stakeholders. This is you. We relay information from what you've been saying here. We take this to the scientists who are meeting at their science groups. One of the things that we're doing as well is we're encouraging collaboration amongst scientists who are working in different fields. And this is fairly recent in sort of the way the scientific world works. Mainly people have, specific specialties, and this is what they deal with all the time, and they only talk to other people who have those, working in those specialty areas. Now they're realizing that there are all sorts of different areas of research and science that can be brought together to try and solve actual everyday problems. And this is what we're doing as well. We're also encouraging collaboration about different research groups. So it's not just POND scientists, we're talking to other scientists too, other organizations. And what we're going to be doing as well, what we're doing with the website, and I'll show that in just a moment, is that we're providing evidence-based information about the conditions. And one of the things that we've done is we made the decision that mainly what we're putting on the website are things that are actionable, is things that you can use in everyday life with your family, with your kids. So I'll show you that in a second. The other thing is that we're going in and we're teaching a new generation about KT. These are students in health sciences at McMaster. These are the group we're working with at the moment, teaching them about KT and how they take this into their practice once they, most of them want to go to medical school or they're going to go into other healthcare areas. So we're doing that with them as well.